Well, first of all, I want to thank you guys for stopping by the website here and finding out a little bit more about us. We are primarily we're a sleep laboratory. What we do is we do overnight sleep studies. But unlike most sleep laboratories, we also are very active in a new concept called home sleep studies. Now, home sleep studies have been around for years and years. Very few of the labs in town really embraced home testing. We're one of the few that really stepped up and said, you know, we think this is the future. And as a result, we decided to go forward and purchase the necessary equipment and develop the necessary skill sets to deliver home sleep tests. To put a final cap on what is our primary product, our primary product, and where we're trying to really focus our attentions, are to help those people who have already been diagnosed with sleep apnea. So many people are out there who have gotten their equipment, who've had their sleep tests, they've gotten their equipment, and what ultimately happens is once that CPAP equipment has been delivered to you, you're sort of forgotten about. You know, a lot of times they may ask, your primary care physician may ask how you're doing, but honestly, they're not in a good position to really truly evaluate the effectiveness of your sleep therapy. And we are dealing with a lot of people presently who have been wearing CPAP 3, 4, 5, even some as many as 10 years old. And the equipment and technology has changed radically. Additionally, the patients themselves have changed. People have gained weight. People are, no longer the person they were 5, 6 years ago. They need to be reevaluated. So really, we are focusing. Of course, if you have not been diagnosed and you suspect that you have sleep apnea, or your bed partner or your spouse believes that you do have sleep apnea or there's something wrong, you can certainly come to us as a new patient. Again, as I said in the previous answer, the biggest thing that sets us apart is that we are actively involved in home testing, and we are actively looking for those people who have already been diagnosed. We believe that patients who have been set up on CPAP should be monitored and looked at least once a year. You can come here, we can find out what it is you need, we can check your equipment to make sure that it's working effectively, and we can make sure it's working effectively for you. So that's the principal difference. We're a one-stop shop. I guess the best way to put it is we're the lens crafters of sleep therapy. I guess the best way to describe the fact that they are responding well is that a great many of our newer patients that we get referrals from, they're coming from our own patients. So they're basically meeting a friend or a relative and saying, you know, I had good care with the guys over at UDT, and they really helped me, and so that we end up seeing those folks as well. When people have been chasing around town just trying to get a new mask or get some kind of help with their therapy, and there really just isn't a place to go, they're really happy to find us. It's a lot of fun for us too, from the clinician point of view, because it isn't often that you get to have patients call you and say, boy, I had the best night's sleep that I've ever had because I'm now wearing my CPAP effectively. We've had that statement happen on more than a number of occasions where they call us the morning after their first night on therapy, on new therapy, using the right technology, and they finally, after years, have finally gotten a decent night's sleep. And it's amazing what a difference it makes in your life and how you just approach your whole existence. I mean, from your work to your play to your relationships with your significant others. If you're rested and have energy, you'll do better. And so we have a great response. I think we have a great response from new patients and also our existing patients.